Hidden heart risks. Arsenic in drinking water may threaten cardiovascular health. Introduction. Arsenic is a naturally occurring element found in soil and groundwater, but when it ends up in our drinking water, it can quietly pose serious health risks. While its link to cancer is well established, new research from Columbia University's Mailman School of Public Health reveals a growing concern. Even low levels of arsenic exposure over time may significantly increase the risk of ischemic heart disease. This discovery has prompted scientists and public health officials to question whether current safety regulations go far enough to protect communities across the United States. The study, Long-Term Exposure, Lasting Damage. The study analyzed health data from individuals exposed to drinking water containing varying levels of arsenic, including amounts below the current federal limit of 10 micrograms per liter. Over the course of a decade, researchers found that individuals exposed to arsenic levels as low as 5 to 10 micrograms per liter had a 20% greater risk of developing ischemic heart disease, a condition that includes heart attacks and other circulation problems. Even more striking, those exposed to the EPA's current maximum, allowed level of 10 micrograms per liter, faced a 42% increased risk. These findings challenge the assumption that current safe levels of arsenic are adequately protective, particularly over long periods. How arsenic affects the cardiovascular system. Arsenic can enter the bloodstream through drinking water and gradually accumulate in the body, where it may damage blood vessels, increase oxidative stress, and trigger chronic inflammation. These changes can weaken cardiovascular function and make it harder for arteries to remain elastic and free of blockages. Researchers emphasized that arsenic exposure during the 10 years prior to a cardiovascular event had the strongest association with increased heart disease risk, highlighting the cumulative danger of even modest exposures over time. Beyond cancer, why current regulations may fall short. For decades, arsenic regulation has focused primarily on cancer prevention. However, this study adds urgency to the need for regulatory agencies to consider non-cancer outcomes such as heart disease. Current U.S. standards were set with cancer risk in mind, but this research suggests that long-term cardiovascular impacts occur at levels once considered safe. Additionally, some public water systems use fluorosilicic acid as a source of fluoride, and this compound can sometimes be contaminated with trace amounts of arsenic. This dual exposure, naturally occurring arsenic and contamination from treatment chemicals, may increase total arsenic intake in ways not fully captured by current monitoring practices. Call to action. What can you do? If you live in an area with well water or older infrastructure, it may be worth checking your local water quality report. Private well users, in particular, should regularly test for arsenic. Home filtration systems that use reverse osmosis or activated alumina can effectively reduce arsenic levels in drinking water. Public health advocates are also urging policymakers to lower the legal limit for arsenic in drinking water and implement broader testing for at-risk communities. These actions are crucial not just for cancer prevention, but for reducing risks of chronic heart disease across generations. Conclusion. The Columbia University study adds compelling evidence that even low levels of arsenic in drinking water are not benign. Long-term exposure, even below federal thresholds, can quietly increase the risk of ischemic heart disease. This growing body of research calls for a re-evaluation of current water safety standards and stronger public health protections. As individuals, we can take proactive steps to test and filter our water. As a society, we must advocate for safer infrastructure and evidence-based regulatory change. The water we drink every day should nourish our health, not quietly undermine it.